training and nutrition. Hello everyone, welcome to the TRT and Hormone Optimization channel. My name is Danny Bossa. I'm joined today with Scott Mendelson. How are you, Scott?
I'm well, how are you?
I'm doing fantastic, thanks. So, a little bit of a different video today. We typically do a lot of the hormones, the TRT, the DHEA. We even touched on, low dose anabolics for health and all these other kinds of things. So today is going to be more about training and nutrition. So a lot of you guys are, you've gotten onto TRT, you're saying, hey, my levels are great. I feel a lot better, but I'm not really progressing in the gym. I feel like I'm training hard. I feel like I'm eating well. I've got all my health stuff done and my vitamin D levels are up and I'm eating healthy. I'm staying away from junk. I'm staying away from cigarettes and alcohol and all this other crap. But I'm not really quite gaining what I thought I might have gained in working out with now my optimal levels of testosterone. And Scott Mendelson just happens to be an expert in this field. He works very closely with Eric Serrano at Infinity Fitness. If ever you want to reach him at any point of this video, his email is listed right under his name, scott@infinityfitness.com, and he'd be more than happy to help you out with papers and literatures and research and ideas and all kinds of stuff that they're working on very intensely these days. So Scott, I'm going to leave it to you. Share your knowledge by all means.
I went through a bunch of old emails after our last podcast and try to gather some data on what are the limiting factors for people that are optimized and not optimized as to why they're not getting the results that they want. And in terms of training, 1, the tactics they're using are wrong. 2, the intensity is not high enough. 3, they're overtraining. So those 3 factors, if they can be turned around, will make a dramatic impact on somebody's results. And you and I were just talking a few moments ago about what I perceive to be overtraining. First of all, people have to differentiate. If you are natural or optimized, your capacity to recover is going to differ quite a bit. And I work with clients in both of those different areas. So what I would assign in terms of training volume for one client versus another can differ based on their recovery factors. And you always want to, I would say, take on the side of caution and be short of overtraining rather than flirting with it all the time. So in some generalities, for somebody who's Joe average, person is natural, working a job, has a family, I perceive a lot of the viewers for this particular channel probably, I'm going to assume between 35 and 55. The right session length for most people is 45 minutes. And I'm talking very high intensity. I'm not talking the Mike Mentzer high intensity one set to failure necessarily, but high intensity in regards to high work output. So, I sent over some videos today to Danny to show examples of cluster 6 pause training. And that's something that Dr. Serrano invented. And I've played with it a lot, used it with a lot of clients. And it's something where the sets are extremely intense. They may last anywhere from 2 to 3 minutes, but you don't need to do a lot of the sets, but you get fantastic muscle fiber stimulation and the workout ends up being very compact and dense. That being the case, I believe that's very good for raising fat burning hormones as well. And because you don't need a lot of sets, you then have workouts that are probably with that particular style of training somewhere between 30 and 40 minutes. And when clients are done, they'll say, wow, that was hard. And I'm looking at their loading, when they send it to me by email, and I can tell based on a lot of factors, how hard are they working? Sometimes they'll have, somebody take a video of them over the phone and, send it to me so I can kind of see what's going on with the set, how intense are they being. But you're looking for those loads to gradually go up incrementally.
Go, 6, chest out, 1, tight, on this side, you need to use this, 3, come on, 4, 5, one more, 6, okay, 7 next. You can rest down there if you want to, that's okay. Ooh, it's burning, that's what I want. Go, here we go. Oh, I know, come on, go, push against me, there we go. Come on, go, there we go. 6, one more, 7, okay. You got one more.
Come on.
Come on, babe. Got it.
Okay, go, Rick. Come on, push against me. Lean back. There we go. Lean back. 2, lean back. 3, lean back. 4, come on. 5, come on. 6, 7. One more, Rick. One more. There we go.
I got you. So, in regards to your work that you're doing with Eric, you talked a little bit last time about little variations on exercises. You want to go a little bit into that? Some of the things that you say you've been doing actively that kind of very much outside the box in regards to what we see in the typical bodybuilder magazines.
Yeah, it was funny. I was watching some videos a client sent me last night of a very famous bodybuilder and watching him do a lat pull down, and it was terrible. I mean, it's like this person knows nothing about physiology, but they have great genetics and, you know, they look great. And it's not due to their smart training, let's say that. So Dr. Serrano often looks, when he's creating a new exercise, he has patients come in who complain about pain or dysfunction. So he's trying to dream up things to fix it. So he's very big on full range of motion. And this one is, you know, drives me nuts. And if you look on Instagram or YouTube, you see all these people dumbbell pressing. Very few of them go all the way down, right? They're not touching the chest. They're trying to handle heavier loads. They're cheating the reps. They're not going down all the way. Well, it's not just a matter of shortening the reps, and you can call that cheating yourself, but you're creating some imbalances. I think that's a surefire way to make your shoulders sore, you know, and some other problems. So you need to get a full range of motion. So that's something he harps on all the time, Dr. Serrano does. But with like the cluster 6 training, I'll give you an example. We were doing, one of the videos I have is a shoulder press, which they can queue up, where you do a cluster 6, which means you do 1 rep, rest 6 seconds, 2 reps, rest 6 seconds, 3 reps, rest 6 seconds, etc., all the way up until 8. So you're getting 36 reps into a pretty short period of time. And those 6-second rested periods in between aren't really rest. You're holding the load, or you might be in a position where you've got, you know, the weights there. We do different things with pauses and so forth to make it harder. I did that sequence with 50 pounds and it was hard. You know, I've done that a few times. And I would say that it felt like more stimulation than probably 2 or 3 traditional sets. The point is, though, I got it done in the span of 1 set. So that's an example of coming up with different exercises. Dr. Serrano does that pretty often, and they're usually to fix some sort of problem.
And that's the putting it up still. 1, 2,
How many here?
6, 3, 4, 5, 6. That was so hard.
I'm in trouble.
Oh, he's in trouble. I know. I'm gonna enjoy this. There you go, buddy.
I don't know, there's
7. 1, 2, 3, 4. Very impressive. 5. Oh, that's good. Yeah.
Where do I go from here?
Okay, you're supposed to put your set. That means that's where you start. But remember, he was doing pause at the middle of the rep. I can allow him to rest now. I said just do 7 when I tell you. And I'm gonna give him, believe it or not, I'm gonna give him 15 seconds. He's gonna feel like a whole new world. It's breathing hard, even though. Go, Scotty.
My hands hurt.
But look how easy he's doing now, even though, look at that. Good job. 6, 1 more. That's 7. That's okay. He did his set. He knows your feet. No, I know that he
Too heavy. Should have gone to 45 because
I don't agree with Scott. It wasn't too heavy. He was pausing midway.
Well,
Which made it very heavy. But I think he would have done the set if we would have paused at the bottom.
yeah, I mean, if I had done it differently, it would have been less challenge. But the point here was to do something challenging, and next time I'll beat that by getting more reps in the sequence. That's a win.
Agreed.
Okay. And so is there every real place for not doing full range of motion? I've seen people saying, you know, you're doing, you're doing pull-ups, let's say, for example, and they'll say, you know, maybe you can do just halfway down and up and halfway down and up instead of all the way down, all the way up. You can do that for a while, develop some strength, and then go back to full range.
I think that's an example That's an example that makes sense. If somebody's trying to improve on their pull-ups or they can't do any pull-ups that are doing a partial range of motion is a good thing. But the ranges of motion they leave out, I would do elsewhere. So for that example, if they're only strong enough to where they can do the top half of a pull-up, that's fine. But I would have other sets maybe dedicated with vertical pulling with cables that would give them some extra work in that bottom range of motion to try and build up that strength and make sure an imbalance doesn't develop. But that's a good example. Power lifters, which I have some clients that are power lifters, there are certain movements with tricep presses and things like that where you would do a partial range of motion to try and fix a weak spot exactly. But what I don't think that's on the mind of a lot of people that I see in gyms or on the internet who are doing partial reps. They're just trying to put up bigger loads than what they can really handle. And the point is, they're not seeing a good example because I think that, eventually leads to imbalance and injury.
Okay. For the video, we were talking about how you feel people are going to an intensity that they think is sufficient, but you believe it would not really be sufficient, that they can actually go a lot further.
In a lot of cases, yes. I'm fortunate to meet with a lot of clients and I get to put my hands on them and kind of see them train. And I don't say a whole lot, in the first session and say, what is their intensity level? And you have all over the map. You have some people that instinctively, I think it's a minority, that, just use a tremendous intensity and effort. That's a small percentage. And then there's some people who are extremely lazy and just, very risk adverse. They don't want to push themselves at all. But most people fit in the middle. And, part of what my job is to get them to understand how to get more benefit out of a workout. And sometimes it has to be a gradual approach. And the best way to do it is to be there with them, have them select challenging load, watch the form, and make them understand there's a little bit more in the tank than what they realize. So a lot of people have mental barriers because they're uncomfortable with certain exercises. For example, I would never take a new client and say, we're going to max squat today and we're going to push the limits. That's a big risk because if they lose the form, there's going to be an injury. So, I think that's idiotic, to do something like that. You don't do max reps on deadlifts because that's a movement that shouldn't be over 5 reps ever, in my opinion. So you have to have kind of the right, selection there. But sometimes I'll train with clients if I'm traveling with them and, I'll put some pressure on myself to be really intense. They're like, wow, that looked hard. Well, yeah, it was. So I think it's a learned behavior and it can be gradual. But once people start using the right tactics and they begin to apply the necessary intensity, push their limits with proper form, of course, and do that consistently, they're going to have a much better rate of progress with muscle growth and fat loss. Absolutely. And some men need more loading than others, just genetically, looking at their fiber types. So it could be that you have somebody's more ectomorphic. They may not need to apply as much intensity to the weight load just genetically. They may get a lot of reps that are, 60, 70% of, max load, and they can crank out a lot and do well that way. But I find that with people who have more of a fast twitch fiber dominance, they need more weight load and they need to push the limits, on that. Again, with proper form and certain exercises, a spotter. But this is all kind of part of what I do when I assess a client. What are the areas that, need to be focused on for that particular time?
Gotcha. I have to ask this now because I know I'll get asked it. When you said deadlifts not more than 5 reps, would you say that typically guys should be doing anywhere between 1 to 5 reps at any given set for deadlifts, or
yeah,
there's never any place to go higher?
Not in my opinion. I just don't think it's a good movement that's designed. I think the higher the reps, the more likely you are to have a deterioration in form. When I use deadlifts for a client, first of all, I like the trap bar deadlift. I think it's a lot easier to master than traditional deadlift. And if you're not competing, why not use a trap bar deadlift? If you're a power lifter, you have to use a traditional, deadlift in your competition, or, certain athletes it may be related. But I think a trap bar allows for an easier mastery of form and you can almost squat the load. So I like doing more sets for a deadlift, heavier loading, and, I could have a client work in a rep range of 2 to 4. So if they get 2 reps on the set with proper form, they keep the same weight load for the next set. If they get 3 reps, they keep the weight load for the next set. But if they get 4, the upper range of the reps there, that would indicate they should move up the weight load for the next set, whether that be 5 or 10 pounds. I'd have that figured out, for them, how much they're supposed to go up. So then the weight load kind of guides the loading. And something else is that I think there's something to accomplishment when you talk about testosterone levels. if somebody goes into a workout and they know there's progressions and they're working very hard and they can see those progressions in weight load, I think that the accomplishment in itself is anabolic. I think that it leads to more confidence. It leads to more satisfaction that things are getting done. And there's no doubt when loading gets better, muscle growth gets better, body fat loss is also accelerates. So there's something to the quality, and you want clients to continually get better. Now, it's okay to fail. I mean, if you pick a weight load and it ended up being too heavy and you got 3 reps instead of 4, okay, no problem. Well, you adjust for the next set. That's not a failure. But, sometimes there's going to be failures when you try a weight load you haven't tried before. I mean, over at Dr. Serrano's place, I fail all the time with crazy stuff he has me, doing. And, it's not necessarily a bad thing. It just, I've got to improve that the next time.
Right. And there's also a lot to be said in regards to the psychological benefits. Just to give it a simple example, if my dose is the same, my testosterone levels stay the same, I can tell you that there's a huge difference in the way I feel about myself when I'm during a time that I'm training really, really intensely. I'm making big gains in the gym. I'm getting stronger and stronger. My weights are going up. I'm noticing changes in the gym. My levels are the same, but in my head, I feel completely different than if I have to take time off. I'm taking time off right now. As an example, I have major tendonitis in both arms, really, really, really bad. And it wasn't healing. I said, look, I'm just going to take off till January, till it heals, and then I'll get back on it. I have the same test levels that I had a month ago. I don't feel the same. I don't feel the same.
I think that in your case, and this is something I see a lot, people have a chronic injury and it's like, I've got to rest it or it's not going to get better. And I understand that. But being on the sideline and not being able to train has an effect on them. I think testosterone levels play a role, but also endorphins. You're not getting the good things that go on in the brain from training because you're not training. But what do you do when you have a chronic injury like that tendonitis? Well, the best answer is don't let it happen. But of course, it's usually in place before we can address it. I'm going to make an estimation that many injuries, whether they're tendonitis or other chronic things, not an acute injury like a muscle tear, a lot of them have to do with form, of course, maybe overuse, just having an imbalance, but a lot of times a lack of recovery, both metabolic and neurological. And that was something else we had talked about, is there's 2 types of overtraining. Well, maybe they're related. Let's look at it this way. There's the metabolic, the muscles themselves and the tissues, then also the nervous system. And if you're not fully recovered from one session to the next, you're kind of putting yourself in a situation where you're just treading water. It's hard to make progress. The tissues aren't fully recovered, so they're more exposed to injury. And that's an area where I focus with clients immediately. I've got to get the training volume right, which I'm going to err on the side of caution by doing less. I've got to do things with supplementation, nutrition, and also lifestyle habits to accelerate recovery. And 1,000% of the time, that helps clients. They're in the gym less. They have time to do other things they've got to do, whether at work or family obligations, which then reduces stress. I mean, I had a client that I talked to recently. This guy was getting up at 4 a.m. so he could train for 2 hours every morning. I mean, it was insanity, and I said, we're going to cut this back to 45 minutes. And he goes, well, so I can sleep an hour and 15 minutes later? I said, yeah. And it's worked remarkably well. And I would say the main thing I did is took him out of overtraining hell. And he since has not had the chronic injuries, progress is better. He feels better because he was kind of, I guess you would call him a type A personality. And there's a lot of people, and I've dealt with it over the years, is that they think they need to train every day for, like an hour or two. Otherwise, nothing got accomplished. And it takes kind of some discipline to know that training too often is counterproductive. And I've had a few that are just, they're obsessed with it. I don't know, maybe there's something else they're trying to compensate for, but I can tell you this, if it's one of those people that's training every day, optimized or not, they're going to crash. They're going to have some kind of issue, whether it be an injury or some kind of, buildup of neurological fatigue where they're going to feel really lousy and be stuck in that spot until they change their habits.
Could it be in regards to people that they know deep down they're not giving it the intensity they could be doing? So instead of me giving it 100%, I'm giving it 75%, maybe 80%. So I'll just do more sets to compensate for, and then everything just gets stretched out.
I think you're exactly right. Whether it be conscious or subconscious, they go, I got 6 sets to do, so I better not go too hard on this first one. I won't be able to complete those. Where the thinking should be completely opposite. You know, I tell clients all the time when I build a program, I very rarely would I assign 6 sets of the same exercise. I don't think that's productive for most people. Well, let's say there's 3 work sets of a 75-degree incline, 1 1/4 dumbbell curl, right? And that one you're on an incline, so it's tough, and you're doing an extra 4th on the bottom. And if they had 3 work sets and they had, you know, pretty challenging loads for the first 2 sets and proper form, and they felt at that point they were completely fatigued, would I be okay with them not doing the 3rd set? Yep, they got the power to do that, you know, I mean, within their form, and they mark it down, and, you know, it's very simple. 2 sets was enough that day. Now, maybe they're feeling real good the next week, and a lot of their recovery parameters were better for whatever reason, and they felt like they could get benefit out of the 3rd set, then go do it. It's kind of, there's a name for it. I don't remember what it's called. To me, it's pretty simple. You do the right amount of sets based on how you're feeling that day, and you can modify accordingly so you don't end up flirting, you know, with overtraining.
I got to say, I have tried over the course of my life training both approaches, doing minimal sets, but those sets were grueling. Like I'm going to throw up, or I have thrown up, or my chest, my heart's beating out of my chest. I think I'm going to have a heart attack, and I only do 2 sets, or I do like the 8 sets, but I'm lifting and I know I got probably 2 or 3 more reps, and I'll put it down. Yeah, but I'm going to do my 8 sets. And at the end of the day, they probably work out to the same thing result-wise. It's just taking way more time.
Okay.
So it's like, well, why not just get it done in a smaller amount of time, go intense, and that's it. What's your thoughts on that?
Yeah, you bring up a good point, and my answer to that would be you cycle the types of training. But in general, what I see with most people who are not optimized, 45 minutes or less is the best way to go. Optimized people may do better with a little more volume, but believe it or not, not that much more. And if I can fit more work into a short period of time, that's what I'm going to do. Now, I might have something set up, protecting the client against themselves, knowing they're very intense, looking at their weight loads, to where I might tell them during a certain phase that, you know, this approach, we're going to stop a rep short of failure. You know, maybe it's a more technical movement. There could be a lot of things, but it is something that I balance. Not every phase should be going to failure. But then again, it does happen intermittently during some sets. Sometimes I like to assign a lot of strip sets, which is really good. You talk about time efficiency. If you can start a strip set with a heavy load and then take a little bit of rest to change the load, most people are surprised how much more they can get. I was with a client recently. What did we have on? We did, it was some kind of dumbbell curling movement. I don't remember what, but, you know, he did 4 reps on the front end. And I think he had 30-pound dumbbells, which was pretty heavy relative to his size. And, you know, then, you know, I dropped it down to 20s, and I think I had him do probably 8. And then I finally had him drop down to 10s, and then he did 12 there. Kind of more of an ectomorphic kind of guy. And he was shocked that he was able to do it. Now, if I wasn't there with him, there's no way he would have done it, because he didn't have a real high level of discomfort tolerance at the time, partly because his recovery was poor. But that's a really good way to pack a lot of volume into a short period of time and kind of manage your loading and, you know, learn to push yourself, because there's something that goes on with the nervous system when you start a set with a heavy load, and the nervous system's ability to kick into overdrive so you can continue even fighting through fatigue with a higher load. And I think part of that is a learned behavior as well by the muscles and the nervous system, proper fueling, recovery, and so forth as well.
I think the main questions that most guys tend to have is, okay, I want to start training the right way. How many days a week should I be training? Because I don't want to overtrain, but I don't want to undertrain either.
Okay.
You know, how am I splitting up my body? I want to work my body twice, you know, each body part, let's say twice a week.
Okay.
How do I determine if I'm going to be putting in the intensity I need? How do I determine, am I doing too many sets? Am I doing not enough sets? How do I ensure that I'm not overtraining? How do I make sure that I'm not undertraining? There's so many of these factors. Even myself, every time it's time, I'm going to redo my workout. It's always kind of that same question, like, is this enough? Is it too much? Should I be, you know, and it's, I guess, is it just trial and error based on you try what and see what works for you? And
to a degree, but I would say if you have a professional person that can give you an opinion on the right volume, that helps a lot, because it's very hard to be objective about our own programs. You know, I know a lot of different coaches and very few of them write their own plans, but it's a hard thing to do for yourself because you get stuck into certain paradigms or certain techniques. So let me, you know, break that into parts. One, I always assess that for clients and kind of get it figured out and make adjustments based on the person's progress over the course of, let's say, a 12-week program. Okay. But in general, I think 4 weight training workouts a week, and I split it up this way for most people. Horizontal, well, let's say chest and back for 1 session a week. And I'm always going to include some posterior shoulder work in that session as well. Then a leg day. And I think you can get all of your leg work done in a single day if you have the program right. But I'm going to get to a second split in a minute. The third one would be, you know, shoulder work, biceps, triceps, and probably some forearm work, and again, some posterior shoulder work as well. The fourth, core work. And, you know, I think that should be functional in nature. Now, I could address that with a functional type workout. It could be done in the gym. I really like medicine ball work. I like combining functional work in terms of fat burning interval type stuff, such as throwing a medicine ball as far as you can, chasing it, throwing it back where you came from. You get a lot of functional work and fat burning interval work at the same time. You know, I don't believe in, like, let's call it crunches and other, you know, I don't even know what you call those, typical core exercises. I think they're worthless. You know, a lot of things like that. I think that functional training, you're going to get a lot more out of that for core development and training the core how nature intended. So that's 4 sessions a week. And somebody asked about this in one of the comments on the prior video, saying, I think I said, you don't need to train a body part more often than once a week in most cases. And that person said, well, I disagree. It should be twice a week. So my response to him was, well, try the 4 sessions per week. And if you think you need more frequency, instead of doing that 4 days out of 7, do it 4 days out of 6. So your week gets shorter, if you know what I mean. And in some cases, you can go shrink it down to 5. I think that's pretty rare. And again, where a lot of people perceive they need more than 1 training session a week for a body part, it's because they didn't train it hard enough, in my estimation, the first time. So there are some things that could change. For somebody, let's say, that has a lot of spare time, they don't have a lot of stress.
Said nobody ever.
Right. So this is usually like a college type kid.
Yeah.
I might have them train twice a day, and I find that to be very productive. Only if they're disciplined enough to take care of what they need with, you know, meals and, you know, recovery, so to speak. You know, they have a lot of time to sleep and so forth. It's amazing. You know, I have a fair number of clients, they'll refer me their kids who are in college, and it's like, yeah, I got time for this, I got time for that. It's like, I don't know what they're learning there in a lot of cases. You know, I don't have any homework, you know, so that they want to, you know, I'll have them train at, let's say, 10 a.m. and 4 p.m. And, you know, then their dining facilities are, you know, real close by. So it's real easy for them. Those are some of the easiest clients to deal with because, you know, they've got some good genetics and they just don't have a build up a lot of problems, and you can build them up from the ground up. But does that answer everything in that question? I'm trying to remember. You had a lot of parts. Okay.
Yes.
Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my bro science hunting partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe.
Click the bell button to get notified.
I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.